Hello everyone. Thanks for standing by and welcome to our Postpartum Depression and Anxiety webinar, sponsored by IsisParenting and Basque Skincare. This webinar is presented by Katherine Stone and Dr. Marlene Freeman, who will join us during the second half of the presentation. My name is Cindy Meltzer. I'm the Director of Community and Social Media here at ISIS, and I'll be your moderator this evening. During this hour-long presentation, all participants will be in a listen-only mode. We're hoping many of your questions will be answered during the information-packed session, but if you do have questions, please submit them in the chat box throughout the presentation, and we will take them at the end as time allows. Today's webinar is being recorded, and all of you will receive a link to the recording in the next 48 hours. So if you miss something or need to step away to tend to your baby, that's okay. IsisParenting is proud to host this evening's webinar. ISIS is the nation's most trusted prenatal and early parenting destination. We provide innovative programs and a highly edited selection of products for expecting and new families in our 4 Boston area centers and online at IsisParenting.com. Let me tell you a little bit about Basque, our co-sponsor for the presentation. Basque is a line of skincare for expecting and new moms that delivers on the promise of real results with real beauty. Basque was founded by 2 business women and moms when they couldn't find anything safe that was worth using during their own pregnancies. They worked with the best minds in beauty, skin science, and aromatherapy to create products women would love. As I mentioned, I'm Cindy Meltzer, and I'll be your moderator tonight. Nancy Holtzman is holding court in the chat room, and she'll be moderating there. I'm pleased to introduce our 2 speakers for the evening. I'm going to start with Dr. Marlene Freeman, who will be joining us for the second half of the presentation. She's the Director of Clinical Services in the Perinatal and Reproductive Psychiatry Clinical Research Program at Massachusetts General Hospital, and she's an Associate Professor of Psychiatry at Harvard Medical School. Dr. Freeman's clinical and research experience has been focused on antenatal and postpartum depression, as well as integrative treatment strategies for mood disorders. And then, of course, I'm pleased to introduce Katherine Stone. She's an award-winning, nationally recognized peer advocate for women who suffer from mental illnesses related to pregnancy and childbirth. She is the creator and editor of Postpartum Progress and a survivor of postpartum OCD. Katherine is also the founder of Postpartum Progress Incorporated, a national nonprofit focused on vastly improving the support and services for women with perinatal depression. Katherine will be starting off the presentation this evening. Welcome, Katherine.
Hi, and hi everybody. I wish I could see all of your faces, but I just want to let you know, first of all, that if you are a mom who is currently struggling, then I'm giving you a big virtual hug. And if you are someone who cares for moms who struggle with these illnesses, I'm giving you a hug as well. I really appreciate having you all here. The first thing I'm going to do is first of all, I just want to let you know that this is going to be, I'm trying to give you a quick and dirty sort of view of the variety of illnesses that women can experience, emotional wellness related illnesses in pregnancy and in the first year postpartum. And obviously I could go on for hours about all of these, but since we only have an hour and I really want to make sure that we answer as many of your questions as possible, I'm going to try to blow through these a little bit. So forgive me if I don't get into a whole lot of detail about each, but I want to cover as much as we possibly can. So with that said, first I wanted to just start off with how many women have these illnesses. And people really don't realize how common postpartum depression and illnesses related to PPD are. I like to say that it's not normal when you go through these illnesses, but it is common. What we do is we take a look at the data from the Centers for Disease Control, which is here in the United States, because I know we do have some people from around the world on tonight. And just looking at the United States, the CDC's data says that PPD affects about 1 in 8 new mothers. But what's interesting about that information is when they did the research They only used self-reported cases, and as many of you know, there's a lot of shame and guilt that often comes alongside of PPD. So many people don't report or even don't recognize that they're suffering. They also do testing really that doesn't get into whether someone has, let's say, postpartum PTSD or postpartum psychosis. They're looking very, more specifically at PPD. And the fact of the matter is they also don't consider women who've had miscarriages and stillbirths. And we know from plenty of research that women who have pregnancy loss for whatever reason are just as likely to have postpartum depression, and the CDC is only looking at live births. So it would be really sort of easy to conclude that it affects far more than 1 in 8 new mothers. And so if you look at their data, it would be around, let's say, 600,000 women a year, but I think it's closer to 1 million. And I think if you speak to a lot of people who are experts, medical experts in this field, they would agree. But of course, either way you look at it, even if you look at the conservative number, 600,000 women each year, every year, is a lot of people to be going through these illnesses. And as it turns out, postpartum depression really is the #1 complication of childbirth. One of the things that I want to talk about that I think is really important is that a lot of people don't recognize the fact that there are health impacts for women who do not get their depression or anxiety treated either during pregnancy or postpartum. People don't know about the health impacts. A lot of women assume that PPD will just go away on its own, that it's not a real illness that requires treatment, but it is. It's very real. It's nothing that anyone has done to cause it. It's not your fault if you have it. You're not a bad mom, and you don't have a bad character as a human being. It really and truly is an illness, and it does need treatment. And so the fact of the matter is only 15% of women, again in the U.S., and I would assume that the numbers are similar around the world, only 15% of people with PPD ever get treated. That's a big problem. So one of the things I wanted to make sure to share is that there are risks to people who don't reach out for help when they have postpartum depression or depression during pregnancy. And I don't want to get into too much of the details, but I wanted to share a few of those risks with you tonight. So first I want to talk about untreated depression during pregnancy. The fact of the matter is that women who aren't treated during pregnancy are likely to have decreased prenatal care, increased use of things to make themselves feel better that are not healthy for a baby because they're suffering and they're not being treated for that suffering, so they may be more likely to smoke, drink alcohol, take drugs. Their babies usually have lower birth weights, lower APGAR scores, and there's all sorts of problematic birth outcomes when women have untreated depression during pregnancy, everything from preeclampsia being 2.5 more times likely, to C-sections being twice as likely, to the baby being twice as likely to go to NICU. So there are a lot of issues around not being treated for depression during pregnancy. When it comes to untreated postpartum depression, a lot of things you can probably imagine around issues with bonding. So it is more difficult for moms to bond with their babies, obviously, when they're suffering. There's an increased potential for child abuse, but I always say, as someone having an illness related to PPD myself, women with PPD are not child abusers. I want to make that very, very clear. We're actually great moms. It's just that there is an increased potential. We're also less able to follow through on normal safety techniques, and like preventing SIDS and strapping the baby in the car seat safely, or in a high chair safely. And the best way for me to describe that, just as one mom to another, is that our brains just aren't firing on all cylinders like normal. So it just makes it tougher to follow through with all of those small details. It's also less likely that we'll continue to breastfeed. And actually, the first year postpartum has a very high rate of divorce and suicide. So there are a lot of really serious impacts for mothers who don't get treated. And unfortunately, many people don't realize this. So we're trying to work hard to make sure that moms know and we can get them the help they need. Also, In terms of untreated postpartum depression, it certainly can impact the child. There's a lot of research into the long-term impact on children. So whether it's impaired attachment, also known as bonding, these children are also more likely to experience psychiatric illness themselves later in life, and there are issues with everything from behavioral functioning, emotional issues, cognitive issues, et cetera, et cetera, et cetera. Don't freak out when you hear that, though, because it's important to know that when women get treated, you can create attachment at any time. So even if you're someone who has or is suffering or has suffered and you're really concerned about whether you have a bond, the right kind of bond that you would like with your baby, you can create that at any time. But obviously it's still very important that women get treated in the first year postpartum. And actually there's lots of research that shows, believe it or not, that maternal depression during infancy has a bigger impact on a child's development than any other time. And I think that's very important to know. So now I've given you a very quick sort of rundown of all the things that can happen to moms when they don't get treated. So the next thing for you to know is really what these illnesses are and what they look like, because there's really a lot of lack of understanding. And a couple of years ago, there happened to be this person named Brooke Shields and Tom Cruise. Some of you may know who that person is, who had a little public kerfuffle about postpartum depression and treatment for it. And I think because it was public and there were books written and newspaper articles written, a lot of people have the assumption now that everyone understands PPD, that we all know how to recognize it. We're all being taught about it in our childbirth education classes, and everyone knows what it looks like and what to do about it. But that really couldn't be further from the truth. There's actually a wide spectrum of illnesses that you can experience during pregnancy and postpartum, and I'm going to talk about each of them. The first thing to know is that you can get these illnesses anytime during pregnancy or the entire year, first year postpartum. And unfortunately, a lot of doctors don't recognize this. So women maybe don't reach out for help until later in the first year, or they just don't recognize that they're ill until later in the first year, and they finally go and talk to a doctor, and the doctor says, oh, you're 8 months postpartum, you can't have PPD. Well, I'm here to tell you that's not true. You can have it any time in that first year postpartum. And also it can occur with any birth. So it might be your first child, your middle child, the last. It doesn't matter. We're all susceptible at any time. So just know that if you do reach out for help and speak with a provider and that person says to you, oh, you can't have PPD, you can tell them that I said that they're wrong, and if they want to give me a call, that's fine, but we'll get them straightened out so that you can get the help you need, because that's not correct. One of the things moms really want you to know, and I try to share some of these slides actually from some of my followers on Twitter, because they like to share with me a lot of the things that they're feeling that they want people to know about. And one of them wants you to know that it doesn't always mean crying and feeling sad when you have postpartum depression or a related illness. A lot of people think they see a commercial for, like, let's say, an antidepressant on TV, and they think, oh, well, obviously if I'm sad and depressed, then I just look sad and I cry and I don't wash my face or put on makeup. And I know that sounds kind of silly, but really that's sort of how people think and what they assume it would feel like to have PPD. And for the moms that don't feel that way because they have other symptoms, they're very confused and lost because they don't understand what's going on with them. So really we want to share with you the wide variety of symptoms that moms can have. So here's some examples of some things from my readers that they've said that they've gone through when they've had postpartum depression or a related illness. They may be physical symptoms like being sick to your stomach, not being able to eat, having headaches. Some moms have no energy, feel like they need to just sleep all the time, whereas others feel like they're full of energy, they can't sit down, they have to be doing things all the time. there are many moms who feel very angry and full of rage and irritability, and that's an interesting symptom that a lot of people don't recognize as a symptom of PPD. I hear about this from moms all the time, that they had a lot of anger and irritability either towards their spouse or partner or their older children or the baby or other people around them, and they're very frustrated about it. And that is a symptom of PPD. Other people talk about crying. Others say they don't really feel anything. They feel numb and disconnected. Some want to sleep all the time. Some can't sleep at all. Some have a difficult time actually taking care of themselves, whereas others are, putting on the makeup and putting on the outfit and trying to let people, hide the fact that they're suffering. So hopefully you can see from this list that there's a wide variety of symptoms that you can have with PPD, and it's important to know that so that you can recognize what's happening with you. I'm hoping this is all making sense since I can't see any of you shaking your heads.
I think it is.
Okay, good. All right, so now I want to talk a little bit, so we're talking about postpartum depression right now, and I want to share a little bit about what the risk factors are. It's not as though there is one single cause for postpartum depression. I think a lot of people asked questions about the causes of PPD in the initial questions that you're able to submit on this webinar, and there really isn't one cause. There's a lot of things that lead to it. Oh, Marlene is here, yay.
Hello.
Hi. So I'm talking right now, Marlene, about the causes or risk factors, that is, for PPD, so please jump in.
Okay.
Certainly, genetics, your history, your family's history. So if you've had a history of depression or any other mental illness, if your mother had postpartum depression, your sister, other relatives, or if your family has really any sort of history of depression, anxiety, things of that nature, then you do have a higher risk. Another issue to point out is diabetes. If you have type 1, type 2, or gestational diabetes, you have a higher risk for PPD. And then another is thyroiditis. So a lot of people will say that it's good to get your thyroid checked if you're having some of the symptoms that I just talked about, because sometimes they're actually caused by problems with thyroid functioning, and once you get that fixed, it eliminates the symptoms of depression. Another set of risk factors are things like personality style. So unfortunately for perfectionists like me, we are at a higher risk of getting postpartum depression. So if you're shaking your head right now and you know that you're a perfectionist, then that could be one reason if you have PPD. Another is just the pressure that many of us feel to be super moms these days and be able to do everything all at once with a smile on our faces, which obviously is not possible. So those things can lead us to being at a higher risk for postpartum depression. Finally, as well as things like childhood trauma and maybe difficult relationships with our own mothers, and even with mothers with women who lost their own mothers at a younger age. So there are a lot of sort of traumatic childhood things and relationships with women that can affect whether a mom might be at a higher risk for PPD. And then the
Katherine,
last...
can I interrupt you for one second?
Yes.
I just wanted to let you know that Dr. Freeman is now on the line.
Yes, I see her there. I'm so glad you're here.
Welcome.
I know.
Thank you.
Please just tell me to shut up and jump in whenever you want.
You're doing great.
And then that final list of risk factors are more of the things that I think people are a little bit more aware of when it comes to things that might lead to PPD. Any type of major stress that you're going through, that could be financial stress, which obviously lots and lots of people are going through these days, marital stress or lack of partner support, or maybe you're a single mom, any type of big events perhaps that have happened recently, whether it's the loss of someone that you love, a house move. That surprises a lot of people, that actually moving to a different city and moving to a different home can lead to depression, or a job loss. Those sorts of things can put you at a higher risk. Complications that you have in pregnancy. So let's say you had hyperemesis or bed rest, or you have issues with breastfeeding, or there were serious complications with the birth. All of those things can put you at a higher risk. And the list keeps going. Mothers of multiples, moms who've been through infertility. You can actually have PPD if you've adopted. It's called post-adoption depression. Previous miscarriage or perinatal loss, and teen moms. And Nancy, just so you know, I can see that chat. And I want to throw this in really quick because I see a lot of people asking about resources around the world, and Postpartum Support International is everywhere. So you can get support in Canada and lots of other countries. So if you just go to postpartum.net, www.postpartum.net, and click on Get Help, there'll be a Get Help button there at the top. And there's either a list of all the states in the United States, or you can click International, and that will show you all the people around the world in various countries who can help you. So I just wanted to make sure to get that out there because it looks like a lot of people are asking that question.
Thanks, Katherine.
No problem. Okay, this is something really important, and it's actually a piece that Kate Kripke, who's a social worker, wrote on my site this week, and I really loved it, so I wanted to add this in. A lot of people aren't sure how to tell the difference between postpartum depression and just normal new mom stress. Everybody who has a baby is obviously tired. It's hard to get sleep. It's a major transition. There's, as everyone always says, there's no guidebook, so you're not sure if you're doing it right. And so obviously new moms are going to be tired, frustrated, worried, and unsure. The way Kate explains it, that's normal for all of us. And yet things like getting some sleep and getting reassurance from others and getting a few days under your belt to figure things out, for moms who don't have PPD, that will make them feel better. So they'll become more confident as time goes on and as they get reassurance and validation and rest and support. For moms with postpartum depression, those things won't help in the same way. You might have people tell you you're a great mom, but you won't believe it. So even if you get reassurance, it won't necessarily make your feelings of inadequacy go away. For many of us, we're convinced, as I was, that you'll never ever get better no matter what. And as time goes on, these things don't go away. It's not as though you start believing in yourself more, you start feeling better, feeling less disconnected or upset or whatever. Those symptoms will continue and in many cases get worse. And so that's a good way of knowing the difference. What do you think of that, Marlene?
Yeah, I agree. I think the key for normal feelings, it's really common to have a lot of anxiety, mood symptoms are common, postpartum blues are common. They're transient and generally don't interfere with functioning. And one of the things that's really important is that being able to tell when things are not normal is not being able to get a break or not being able to enjoy your baby at least some of the time. So we want moms to, what we're looking for is in terms of depression, is if moms can't brighten to good things, can't enjoy their baby. So, anything really that's interfering with function is a time when we really start to worry, and it can be very difficult. I agree completely. It's very hard to differentiate, especially I think for first-time mothers, what's normal being overwhelmed and tired versus what's postpartum depression. So a lot of women will actually be screened for postpartum depression and found to have it and be surprised. The depression may not have been the word that comes to mind, although they can really relate with being anxious or overwhelmed.
Right, exactly. Yeah, so, and I will just say to anyone who's on here who's just not sure, it's okay to ask. It's okay to if you're not sure but you're worried and you just don't feel like yourself, reach out to your doctor, whether it's your OB or your primary care physician, anyone that you already feel like you have a comfortable relationship with, and talk about it. And it may be that you can make a few changes in your life and feel better, or it may be something that is a perinatal mood or anxiety disorder that needs treatment. Either way, you can get help and you will get better. So, all right. So the next thing I wanted to talk about is postpartum anxiety, OCD, and panic disorder. as Marlene was just saying, or Dr. Freeman, I guess I should say, sorry.
That's fine. Marlene is fine.
A lot of people assume that since they're not, what they would assume is depressed, that there's something else wrong with them. I'll hear a lot of people say, I've just gone crazy. They think they've gone crazy. They don't know what it is. It doesn't look like PPD to them, so they're not sure what's wrong. And oftentimes I find that those moms have symptoms that look more like anxiety, OCD, panic disorder. So some of the things to know about postpartum anxiety, OCD, and panic disorder. And let me just say really quickly, you can have the mental health professionals and the doctors in the world have this word called comorbid, which normal people like me who don't have lots of degrees don't often understand what that means. But what it means is you can have symptoms of depression and anxiety both. So you may have one or the other, or you may have several sort of across the spectrum, and that's okay. That's not unusual. But in terms of symptoms of anxiety, usually it's a lot of worry. So you're worried a lot about the baby or yourself, the baby's health perhaps, whether you're doing everything right. I hear a lot of times from women who have postpartum anxiety who just can't get rid of the worry no matter what anyone says. They're continually worried that their babies don't love them, or they're not good mothers, or that something will happen. Those worries can become something called intrusive thoughts, which are even worse, which are what I like to call what-if thoughts. So things like, what if I dropped the baby down the stairs? When I had postpartum OCD, it was, what if I drowned my baby in the bathtub? So oftentimes the what-if thoughts are around thoughts of harm coming to the baby, and sometimes it's harm coming to the baby at your own hand. I knew they were wrong. I didn't want to do them, and they were very upsetting to me. They would just come into my head. I didn't want them there, and I didn't know what to do about it. So if that's something that you're having, please know that that's a common symptom of postpartum anxiety, and that it's not your fault, you haven't done anything wrong, and it can be treated. In terms of panic disorder, some moms actually present with panic attacks. So I hear from a lot of people who have never had a panic attack before in their life, and then they start having them in the postpartum period. Sometimes they don't even recognize them as panic attacks. They'll think they've come down with a terrible disease, or they're having a heart attack, but it's in fact a panic attack, and that can be another sign of a postpartum anxiety disorder. Did you want to add anything about postpartum anxiety?
Yeah, I'd love to. So the examples you gave, I think, are really excellent ones for postpartum obsessive thoughts. Mm-hmm. I think what's really scary for mothers is that they may have thoughts that seem very bizarre to them, and they may worry that they have a psychosis, that they are going crazy.
Right.
And the definition of an obsession is an intrusive thought, like it doesn't feel like it belongs in your head. It's not consistent with your normal thoughts, and it causes a lot of distress. So, and this is, commonly a part of anxiety disorders. Postpartum women are more likely to have obsessions than women who have anxiety or disorders or depression that are not postpartum. And the fact that women recognize these as distressing is actually a very good sign, because these are treatable, and it is a very big distinction from postpartum psychosis, when that's a extremely different situation where someone with psychosis does not have good insight. They don't recognize their thoughts as reality-based or not. So it can often be mistaken for that if someone doesn't know a lot about postpartum OCD, anxiety, or depression. Sometimes healthcare providers don't know much about the difference. So it's really important, I think, that the public in general is better educated about that, because it is very common. And I think women are very relieved to hear that postpartum obsessions are common.
Right. I know for me, I really thought I was this horrible, dangerous human being. And, finding out that what I had had a name, intrusive thoughts, and that I wasn't a bad person, that I wasn't going to do these things, and that they could help me, it really saved my life. So it is really important that people know about them and know that they can be helped, and also to know that it is not psychosis. There really is a big difference between postpartum OCD and psychosis, which we will talk about in a second. Another sort of illness on the spectrum is postpartum PTSD, and a lot of people aren't aware of this. Post-traumatic stress disorder really can happen when a mother has a perceived or real, either way, it doesn't matter, as long as it's her perception, trauma, either at delivery or in the postpartum period. So let's say there's an emergency C-section, or the baby is born distressed, or there's any sort of thing that happens during the delivery that is very upsetting to the mother or makes her feel as though she's sort of lost control and powerless. These can put her at risk for having postpartum PTSD. And I've heard from a lot of moms who really feel as though their experience with delivery was not anything like what they had expected and was very scary and traumatic, and this leads them to having post-traumatic stress disorder, the symptoms of which can include having flashbacks of what happened, nightmares, sort of inability to get them out of your mind, and a lot of times these moms will really avoid things related to that event. So they might not want to go back, let's say, for the postpartum follow-up visits, or go back to the hospital, or have anything to do with that doctor and hospital because of either how they feel they were treated, or how they feel things went when they were having their baby. Marlene, anything to add on that?
No, I mean, I agree completely. I think one of the ways that we can, help women be prepared about what to watch for is asking about previous pregnancies, complications. Unfortunately, losses often trigger a lot of anxiety for future pregnancies. So I agree completely.
Mm-hmm. Mm-hmm. Yeah, I mean, the thing for people to know is that it's anything for you that's traumatic. And even if other people don't think it is, if it felt that way to you, then certainly it can be a risk factor. So it's important to know that. Okay, psychosis. Psychosis is obviously the most serious, although I don't mean to say that they're not serious, but this one is the most dangerous of all of the illnesses, perinatal mood and anxiety disorders. One thing that's different about it is that it does seem to have a much quicker onset than postpartum depression. So they say the average onset for PPD, at least in terms of diagnosis, is somewhere between 4 and 6 months postpartum, I think. Is that right, Marlene?
I'm sorry, can you repeat that?
In terms of PPD onset, usually isn't it, the average in terms of when women are more average diagnosis, it's something like 4 to 6 months postpartum, right?
Yeah, I mean, I think you'll hear, you can actually hear debates on this topic. I mean, probably onset within the first 3 months. I would consider the first 6 months as a vulnerable time, and I think it's fair to say that extends really through the first year. But I think onset is usually within 3 months, although certainly can last a lot longer.
Right. Whereas with psychosis, it's much sooner, right?
Usually it's much sooner, but it isn't always much.
Okay.
It isn't always sooner. So for example, I've had patients in my practice who've had onset around 3 or 4 months postpartum, which is not typical, but then it makes it a lot, harder to predict. So not everyone's going to fall into the pattern of having really early onset of postpartum psychosis. But if someone's had postpartum psychosis before, or they have a diagnosis of bipolar disorder,
right.
You're right that we do very much worry about the very early postpartum. And so sometimes having the plan of waiting till someone's delivered to start a treatment to prevent postpartum psychosis in someone in really high risk isn't soon enough. So
right.
Very often if someone is very high risk, they've either had postpartum psychosis before or they have bipolar disorder, if they're not already on treatment, we would usually start a treatment in the 3rd trimester to avoid, what is often really a catastrophic illness. People
right.
get very ill when they have this.
And that's a key, a very important thing for everyone to know, is that one of the key risk factors for psychosis is bipolar disorder. And that can be bipolar disorder that's been diagnosed or hasn't. So it might be someone who has it, but just has never recognized it and had it officially diagnosed. And then the symptoms include everything from delusions, and that's where we get into this discussion about the difference between intrusive thoughts and delusions. And I think Marlene said it really well. It feels like with an intrusive thought, it's like something that doesn't belong in your head. You know it's not right. You know it's not the way you would normally think. Whereas oftentimes with delusions, there's a real belief that, let's say things like my baby is possessed and I must do X, Y, or Z to fix that situation. It's a belief that this is real and has to be acted upon. There can be hallucinations, seeing things that aren't there, mania. I've spoken to many women who've had postpartum psychosis who say they actually suddenly had this amazing energy. They felt like they didn't need to sleep, that they could accomplish many things at one time. Sometimes there's paranoia, so a feeling like if people try to help, that they feel paranoid that they're not really trying to help. They may be trying to harm them in some way. Also things like, obviously, suicidal and homicidal thoughts. And the important thing to know about psychosis is that there's a 10% infanticide or suicide rate, and that's why it's so dangerous. So it really is considered a psychiatric emergency, and whether it's, there's a spouse who believes, that their or partner is suffering, or a family member, or a doctor, this is when you need to call immediately and have this mom hospitalized so she can be stabilized. And I thought you might want to talk about that a little bit, Marlene.
Right. So I think it's just such a key distinction between the anxiety and obsessions versus psychosis, and really the whole thought process is so different. And it's kind of scary and also kind of amazing how much illness sometimes families will put up with before asking for help. So
right.
In very many situations, if a woman has postpartum psychosis, it takes a while to come to treatment, and a lot of that is because the family is trying to accommodate this. They don't understand what an emergency it is. And very often, this is one of the things that I feel like complicates it, is that very often delusions have a religious nature, and
right.
That can get touchy, to characterize religious thoughts as delusional. Some things are more culture bound than others. It's also very important for clergy to be really well educated about postpartum psychosis. So I've had more than one patient actually seek an exorcism before seeking psychiatric help, and having the family go along with that. And it is truly frightening because, completely unlike postpartum OCD, where it's not uncommon to have thoughts of harming the baby that are intrusive thoughts that don't make sense to a woman. In the case of postpartum psychosis, it will be something like you have on the slide, that the baby is possessed, and so there's a whole intention or thought process behind harm that might come. And so psychosis is also very unpredictable. So in almost every case, we would have a woman hospitalized for her own safety, because some women will hurt themselves. And also, to quickly get a handle on the situation, and can be extremely traumatic for women to be away from their baby and their families. But it is one of those situations where there isn't a lot of gray area. It really is an emergency.
Exactly. Okay, so the last one we're going to talk about really quickly is antenatal depression, which is depression during pregnancy. And this is pretty much as common as postpartum depression. And an interesting thing to know is that a lot of women who end up suffering depression during pregnancy do so because they were already being treated for depression. They've had depression in the past, and they go off their medication during pregnancy. And research shows there's a really high relapse rate when that happens. Now, of course, a lot of people are very scared about taking medication during pregnancy. I know I was. I had postpartum OCD with my first child, and I didn't plan on having any more because I didn't want to go through that again. But I Ended up getting pregnant, thankfully, because I love my sweet girl. But I made the decision to stay on medication, and it was a very nerve-wracking decision. But I decided for me that based on all the research that I could take a look at, it was the best thing. So I thought really quickly, Marlene, maybe you could talk about that, because I have seen some people in the chat talking about concerns about medication during pregnancy.
Yeah, so I mean, I think we have so far to go with postpartum depression and anxiety, but we have so much farther to go with disorders during pregnancy. I think that there hasn't been the same I think advocacy and education around treatment during pregnancy, and there are so many women who believe that they can't be treated during a pregnancy, particularly with medication.
Or breastfeeding too, I'll throw in.
That's true, yeah. And there are still myths that are widely out there that women don't need to be treated during pregnancy because women always do better during pregnancy. And so we're in a situation where there's a lot of information out there that is given to women by healthcare providers and other sources that is flat out wrong and contradictory. And I think it's a terrible situation for pregnant women to be hearing different information from different sources. And unfortunately, some of those are agencies or sources that really should have better information than they do. And the other concern I have is that when you go to the popular media, like television commercials, you can hear extremely scary messages about treatments that may be appropriate first-line treatments for many, many women, but they're hearing extremely scary messages. And I think that there's a great deal of stigma around needing treatment during pregnancy.
And then, postpartum, for that matter, unfortunately.
Definitely, definitely. But I think that there's more, and I could be wrong, but this is just what I see, there's more horrendous advice given to pregnant women because there's more fear in terms of healthcare providers, telling women that they can't take anything during pregnancy, sometimes telling women to stop, it's sometimes life-saving medication. So I think that, that it's true for women who are breastfeeding, definitely true for them too, but for women who are pregnant, they sometimes get absolutely the worst and contradictory information. And the truth is, this isn't the purpose, this is really beyond the scope of this discussion today, but most of the medications that are most commonly used in the treatment of mood and anxiety disorders are ones that we would consider reasonable to use during pregnancy, provided that there's a clinical reason for a woman to be on them. So if women can do fine without medication, they can use psychotherapy or other treatments, we would prefer that. But there are many medications that are extremely reasonable to use, and I think that women get so many mixed messages that it becomes a really terrifying situation.
Right. And this is actually a good segue into treatments, because I know a lot of people want to know about the treatments. And there are a variety of treatments for postpartum depression and related illnesses. One is therapy. Therapy can be very effective. So that's something important to know, because there are certain people who avoid even reaching out for help because they don't want to take medication and they fear that they'll be made to. And so it's important to know that therapy can be a very effective treatment for some women with these illnesses. And there are various types of therapies, but it seems like one of the most common therapy for PPD is CBT, which is cognitive behavioral therapy. I also hear people talking about interpersonal therapy and DBT as well, but that's getting into a lot of technical stuff about therapy when for me and most moms, we're just going to go in there and sit in the room and talk. And it's the therapist who knows exactly what to do to help us create the kinds of coping skills that we need to get through PPD. Certainly another treatment is medication, and for many of us, especially those really with more moderate to severe postpartum depression and anxiety, sometimes medication really is necessary to help get through the more sort of the emergency part of, kind of getting stabilized and getting through PPD. while I realize that some people are afraid of medication, I would say you don't need to be. I've been on it, and it helped me save my life, and I know many people for whom it was the same. But I also know that many of you have asked about alternative treatments, and it just so happens that Marlene has done a lot of work in this area, so she's a great person to talk to about what really does work and what really doesn't, or at least which things really don't have a lot of data right now. So Marlene, I thought you could talk about things like placenta encapsulation, I can say that 3 times fast, hormonal replacement. A lot of people ask about things like progesterone. There's so much interest in how effective these things are, let's say, compared to medication and therapy.
Right. So one of the things, one of my areas of specialty areas is complementary and alternative medicine, and I have to say, even with that interest, we want to really take everything with a grain of salt and make sure we don't find ourselves too enamored with different treatments because they're natural, because I think that's really common among the American public right now. And the truth is we want to be as skeptical about complementary and alternative treatments as we are about medications. I think it's very good to question, the risks and benefits. And some of my personal work has been with omega-3 fatty acids. And the best place for omega-3 fatty acids at this time, based on all the research that has been done, is really as an add-on treatment to medication. So the studies that have been done have generally looked at omega-3 fatty acids in addition to ongoing medication, specifically in major depression or bipolar disorder. They don't seem to have anti-anxiety properties, but more antidepressant. What makes omega-3 fatty acids a really great fit for pregnancy and postpartum is that babies need omega-3 fatty acids for optimal neurodevelopment, brain development, visual development. So it's something that makes sense for pregnant women and breastfeeding women to take anyways. So in terms of adding it to a treatment plan, it makes a lot of sense for the mom's health. The omega-3 fatty acids are famous for cardiovascular benefits, and also for the baby's health. And there looks like there's some good evidence for an antidepressant effect. But I always tell patients with a caveat that we don't have information that omega-3 fatty acids replace standard antidepressants. Right now they look like a good part of the plan, though. Another treatment that also has health benefits that seems like a great fit for pregnant and postpartum women is exercise. So exercise does have a lot of antidepressant benefits. And for a lot of women, just may not be enough. So if someone's really suffering from a serious depression, exercise may not be sufficient, but makes sense to add as part of the plan. And it's also a good fit because there are benefits of regular exercise for a healthy pregnancy, and within reason, recovery, postpartum with doctor's permission, and something like walking regularly counts towards this completely. There are a couple pretty exciting studies with acupuncture for depression and pregnancy. I think that we really need more studies right now. But I think acupuncture is something that's reasonable, provided, in my opinion, that it doesn't take away from something else that's more evidence-based, that has more behind it, like psychotherapy. So if someone, and most people do, have limited time and financial resources, I steer women towards psychotherapy, particularly cognitive behavioral therapy, also supportive therapy, rather than acupuncture if someone's deciding between them. There are some really cool studies with massage, particularly in pregnancy. Again, I wouldn't take resources away from psychotherapy for massage, but it's something that I think makes sense to add to an overall plan. Light therapy, we have to be careful for women who may have an underlying bipolar disorder or have that diagnosis because it can be too much. It can rev someone up into flipping into a mania or hypomania, a condition where they're too revved up, but there is good evidence for depression. Things like placental encapsulation are something that you can read a lot about. The Internet, I think, sometimes really inflates the amount of evidence or gives the appearance that there's more evidence of something than there actually is. And there are no studies looking at placental encapsulation for postpartum depression or any other disorder, period. It's really theoretical that eating one's placenta would would help with anything. There really are no strong trials really looking at any of that. I think there's a theory that makes some evolutionary sense that, some animals do it so it may replenish nutrients. But right now I have to say it is not evidence-based and should not take the place of an evidence-based therapy. And just overall, what I think is the most important thing about complementary and alternative treatments is that seeking those, I think, should never preempt a good, comprehensive, thorough evaluation by a provider that really knows a lot about perinatal depression, anxiety, and even if one is going to seek some of these treatments, which are widely available in some cases, things you can get without a prescription, I think it really makes a lot of sense to have ongoing monitoring by someone who, again, really knows about the conditions, because we want to make sure that women don't suffer indefinitely while they're trying different things and having to be really their own doctor.
Right, and I think it's important to point that out because as we talked about right at the beginning of the presentation, which you weren't here for, Marlene, we talked about the fact that there are a lot of well-researched risks to untreated depression and anxiety during pregnancy and postpartum. So the thing is, I always say to people, if you want to try something that's not going to harm you or the baby, you should do it. And if it works for you, great. If it doesn't, don't hang on to that, convinced that it's going to help you and continue to suffer, because that can actually harm you and the baby worse. So the thing to do is to be well. That's what we're all, going for here, is you being back to the you that you want to be and you being healthy and well. And you can, exercise and therapy and sleep. Sleep's very important. As much as you can do those things, great. If they work, great. If they don't, I always ask people, be willing to try other things, because it's very important. And I know there are a lot of people out there that are just huge proponents of placenta encapsulation, and it may be, that in the future data supports it, but it doesn't now. And so, doctors aren't going to make that recommendation, and certainly I can't make it on postpartum progress, because we really don't like to promote things unless there's a lot of evidence showing that they work. Breastfeeding, I know a lot of people had questions about breastfeeding, so really wanted to get to this real quick. It is not true that you have to quit breastfeeding in order to take medication for postpartum depression or anxiety. There's tons of research about various antidepressants and their use during breastfeeding, and I offer some links here, which I'm sure Nancy can share with you so that you can link through, whether it's from the Massachusetts General Hospital Center for Women's Mental Health, where Marlene is at, or there's also an organization called Otis, which talks about various medications both during pregnancy and in breastfeeding, and then Thomas Hale's Infant Risk Center. And you can click on any of these links, and many of them give very specific information about specific medications and whether they're safe to use during breastfeeding. But the key thing to know is that it's not true that you have to stop breastfeeding in order to be treated for PPD. And I think a lot of people are afraid of that. So if it's something important for you to do, then you should be able to do it and be treated. Okay, well, there's really only a few minutes left, unfortunately, but I'd love to quickly get to some questions if we can.
Yeah, absolutely. Of course, there are a lot of questions that have piled up here, but
right.
Thankfully,
we'll talk as fast as we can.
Exactly.
I just have a technical problem. I can't see the questions, so I just.
She'll tell us. Cindy will tell us what they are.
Okay. Yes, I will read them aloud to you. Sorry, Marlene. I'm trying to fix that for you, and it doesn't seem to be working.
No problem.
So actually in the beginning of the presentation, a lot of people were asking about or mentioning a lack of providers or treatment specializing in PPD in the areas in which they live. One mom talked about going to a 30-day treatment in another state, far away from her house. Someone else was asking about resources to start up a peer support group. What kind of advice do you offer for people who are experiencing sort of lack of resources?
Well, fortunately more and more are happening. The first thing to do is you can come to my site or you can go to PSI and Find out who the coordinators are in your state. Find out, maybe there are postpartum depression support groups and other people that you're just not aware of because no one around you knows who they are. So go to our sites and check those resources first. PSI has coordinators in every state in many countries around the world, and if you just give them a call, even if there's something that's not listed on the site, they may know of someone that's in your town or a few towns over who really can help you. So the first thing to do is do that. The second thing to know is that there are a lot of online resources, obviously not for treatment, but there are a lot of support people around. There's my site. There's Lauren Hale does something called the PPD Chat, which is on Twitter twice a day on Mondays, where you can, if you're someone who's on Twitter, you can join into PPD Chat using that hashtag and actually talk with other women who currently have these illnesses. So, there are more and more things coming online. And if you pay attention to sites like mine and others, we try to share that news all the time. So when web-based video support groups and things on Twitter and things on Facebook, we really try to keep that stuff updated so that at least you have people that you can talk to and find that sort of peer support at minimum. Marlene, what would you suggest in terms of healthcare providers? I'm not sure. I know at some point there were some consultation lines where even if a doctor wasn't specializing, they could call a consultation line to get some help for treating a new mother. But I'm just not sure if they're still available.
Yeah, I don't think that anything like that exists right now, not that I'm aware of. That would be a great system to have in place. I think, it can be tough. It can be tough in different geographical areas to find psychiatrists, let alone specialty psychiatrists. And there are probably, far too few perinatal psychiatrists, which I think is, the term that we would use to describe at least the psychiatrists that we're talking about. But I completely agree with using resources like your website, PSI, to identify therapists, psychiatrists. One of the things that we do in our program, and we're really fortunate in Boston to have a lot of specialists and more doctors than most areas have, but very often we provide services like consultation rather than ongoing care to each person. And in that way, we provide recommendations to other healthcare providers so that it's treatment that's delivered closer to where women live so they don't have to travel far to get specialty care. And it also can make other healthcare providers a lot more comfortable in terms of treating other women that have mood or anxiety disorders during pregnancy or the postpartum. I think that we have a long way to go in terms of solutions, but I hope that that's something that we see more of.
Yeah, we are working on it. So, we're working on it. And oftentimes if you reach out to someone like me or any of the other people that are real advocates in the PPD world, we'll if you've already called PSI and they say there's nobody, we will ask around. So, use us as resources because we do try as much as we can to find those people who can help you. And sometimes if it's not a psychiatrist or a therapist, it might be there's a lot of social workers that really care about this issue. There's a lot of helpful midwives and doulas that care about this issue. So, where you live, who knows who it might be, but that person can be really helpful and supportive to you. So, but you have to reach out and ask. And I know it's scary to do that, but reach out and ask us, and we'll do our best to try and find somebody to help. Any other questions we can answer in the next 60 seconds?
I would be remiss if I didn't ask this one last question about dads or partners who might be suffering from, postpartum depression or similar disorders. Can you give us any sort of soundbite or information on that?
Well, unfortunately, there's even less resources for the dads. And at Postpartum Progress, I really do focus on moms, although I need to add more resources. Marlene, are you aware of any in particular?
No, but I think that new dads are often extremely reluctant to seek help. It's not at all uncommon. It's for new dads to have depression or anxiety, and I think that we just want to be really sensitive in terms of making sure they get help without making them feel like there's something wrong with them, inherently wrong with them. And so, with dads, they're not going to be, pregnant or breastfeeding, obviously. So the medication treatment, if that's sought, isn't going to be as complicated. But we also have to make sure that it feels like a comfortable situation for men too.
Right. And one quick thing, because I think we're going to get cut off pretty quick, is that if you have questions that weren't answered tonight, feel free to stop by my site, send me an email. You can always email them, or I'm sure everybody at ISIS will share them with me, and we'll try to get them answered, because we really do want to answer all of your questions. I know it's important to feel like you're heard and that you have some idea maybe of some resources that you can use. So don't think that just because this is over that we're not all here trying to support you. Just let us know what you need to know, okay?
That's absolutely right, Katherine. Thank you so much. And thank you to Dr. Freeman. We really appreciate everything that you had to offer. And we'd like to thank our sponsor, Basque Skincare. And please visit us on our website. And of course, you are going to get by email a recording of this session and a resource sheet with all the websites that we mentioned and some additional ones, and some contact information for everyone around here. So there are ways to reach out and to get more information. So thank you to everyone for attending, and we hope to see you at another ISIS online event soon. Thanks so much, and have a great night.
Thank you.